accurate are the COVID tests? Pretty inaccurate. The send out lab is a little bit more accurate than the rapid, but they're still not very accurate. It's like a 50-50 shot if you're gonna get a real true result. A lot of that depends on, did someone get a good sample? Where are you in the timeline of when you actually had the virus? Because if you don't have enough virus particles in there for the saliva or the nasal swab to pick up, you're gonna be detected as a negative, even if later on you show up as a positive result. How can you prevent this? One thing you can do is talk to your healthcare provider and ask them, I wanna get a flu test and a COVID test. Rule of thumb, if the flu test is negative, your COVID test should be treated as if it's positive, just because of the inaccuracy. We know so little about this virus, you know? It's hard to detect something that you know so little factor to think is a positive test is a positive, but a negative doesn't necessarily mean negative. Here's my story with that. So the false negatives are if you are resulting as a negative test, but you truly do have COVID. That's a false negative. One of my friends, John, was feeling kind of rough. His company policy is if you get tested and you're negative, you can still come into work. About 6 days into his symptoms, he was feeling a little bit worse, but still just like cold type symptoms, retested, tested negative again. This is right in perfect timing for whenever he's gonna have about 4 people over to his house for New Year's Eve. He shared with everyone, I've been tested twice within the past week. Both times I tested negative, but I don't feel 100%. Of course, everyone felt comfortable going because he had had 2 negatives within a single week. But guess what? Day 10 into his symptoms, John lost his taste and smell, and unfortunately, the people who went to the party, some people started getting sick around that same time, and now everyone that went is COVID positive. It just gives you a false reassurance. Don't trust a negative. Definitely a positive COVID test means you're positive, but if you have symptoms of COVID, even if you get a negative test result, I would say even if you didn't get a flu swab that was negative, treat it as if it's COVID, just because you don't want to spread it to other people. If you get a positive result, how long should you quarantine? They say 10 days from the peak of your symptoms. Well, when's the peak? If you're facing COVID, it's probably really challenging to know when was it the worst, because at one point in your journey, you're gonna feel like death hit you. But whatever day that you feel like you've got the absolute worst symptoms, that day, go 10 days out from that, and after that, they say it's safe for you to be around people. I hope this helps you to understand the importance of quarantining yourself despite negative COVID tests. They're just not very accurate.